Okay, hi everyone. I thought we'd talk a bit about what TAVI is. You may have heard the term a lot used in the media, as well as maybe colleagues or other patients have talked to you about what a TAVI is. Now, TAVI is short for a specific term. It's called transaortic. Um, so trans aortic valve implantation. That's what TAVI is. Now, that what it means is mainly it talks about replacing a narrowed heart valve. It's called the aortic valve, and as we age, calcium builds on the aortic valve, and these leaflets they build on the leaflets, and because there's a lot of calcium built up in the valve leaflets, they narrow, and therefore this is the valve where blood exits the heart and into the aorta. So if there's a narrowing there and blood is not ejected properly into the aorta, not enough blood gets to the rest of the body, and patient therefore can experience dizziness or shortness of breath or chest pain. Now, usually what we used to do was perform open heart surgery to replace the valve, and that valve would be usually replaced by a pig valve or a cow valve, or it used to be replaced by a mechanical valve. But now, in the past 10 years, there's a new procedure that's come in where we can actually replace the valve by a more minimally invasive procedure where we put a tube in a patient's groin, in the artery of the leg. This artery is connected to the aorta and then the heart. And through this tube, we put a catheter around to where the heart valve is, the aortic valve. And through this tube, we can put a new valve inside the old valve. Now, this new valve is a pig valve. It's a animal valve. And we actually put this new valve inside the old valve, and then we open it up with usually a balloon, and the valve opens. There's a scaffold around the valve which sticks to the wall of the aorta and the old valve that's already in there, and squashes the old leaflets apart, and therefore opens up this new valve. And once the new valve is in place, it acts like the patient's own valve. Now, the procedures really revolutionized this medical condition. Now, most patients now are getting treated with this more minimally invasive procedure because it can actually be done under just some local anesthetic and light sedation, and patients usually go home the next day instead of staying in hospital for 7 days as previously with open heart surgery. Now, we used to perform these procedures in more elderly patients who we thought were high risk of open heart surgery, but multiple trials have shown that these mini procedures are actually really beneficial on anyone with severe valve problems or severe narrowing of the aortic valve. So now there's indications that the indications have changed, and by July of this year, essentially anyone with a narrowed heart valve, whether young or old, should be considered or can be considered for this new procedure, this minimally invasive procedure. So it's a very important revolution that's occurred in cardiology. We're doing it a lot in Perth at the moment, and most patients love this procedure because it means they go home usually the next day and they feel much better. They're less short of breath. They don't have chest pain or dizziness after this procedure as well. So I thought I'd just clarify what this procedure is and how it's changing the way we manage these patients for the better.